welcome back to No Filter Needed.
Hi.
It's Monday.
Yes, it is. It is Monday.
It's the start of the week, but a busy week.
Mhm.
And we are going to talk about skin treatments, procedures, everything that we kind of do here, and dive deeper into the education of it so you guys can understand how things actually work.
Mhm.
Do you want to start off?
Sure. I'm going to start off with one question that I think is very relevant to a lot of patients that are coming. Is when a patient comes to you with any type of skin issue, what makes you decide between if to do a facial, microneedling, laser? What is your path through this treatment? How do you go about with it?
So the first initial thing, and consultations are huge, and I feel like the biggest impact
Mhm.
for results.
Mhm.
It really depends on the person's concerns, one, two, their lifestyle, and three, obviously their budget.
Mhm.
So if we're dealing with someone more aging skin or more concerns that we have to work and fix, I typically like to start off with aggressive treatments, whether that's Morpheus 8 or Frax laser, which is non-ablative to help resurface that skin. A lot of the times, too, they more than likely need a conjunction of injectables.
Yeah.
So I do like how I can kind of envision or get a feel of if someone does need injectables and send them your way.
Yeah.
The consultation is the biggest part, and diving deep into their lifestyle, what they're currently using, if they have a skincare regimen, if they are using SPF, anything that can age the skin or disrupt the skin barrier is what I like to know. And then we would determine a customized treatment plan.
I guess it really depends on the concerns of the patients too, and what they would like to address. Because sometimes the patient would come in with something completely different than what I think they need. So
exactly, or they come in for a treatment that they saw online that they want to do, but they're not.
It's not relevant.
Ideally, the right candidate for that. So you have to explain, and education is obviously the most important thing. So when you are educated and we can explain that to patients, they appreciate that and understand why. And then we'll lean more towards the result that or the treatment that they actually need.
Okay.
Okay, so for you, why would you necessarily pick RHA over Juvederm?
Right. So obviously all of the fillers are hyaluronic acid based. However, every filler is different. We carry almost all the fillers, all the brands. The difference between them is really the consistency of the hyaluronic acid and what you're looking to achieve. Yes. And if you're looking to achieve something to build or more to get a softer look, say if you're doing the lips, for me, if I'm doing the lips, I'm looking for a more softer, natural look. I'm not looking to build up a more thicker and kind of rough, hard layer. So for me, my preference will be RJ3 because for me, it's very given. Feels very, very natural on the lips. You don't feel like you have a hard pillow in your lips when you have that filler. So this is my personal reference. I go with either RHA3. Sometimes I will go with RHA2 if someone comes to me and say, I just want a little bit of a plump. I don't want anything crazy. I don't want to just change the complete shape of my lip. I just want a little plump, so then we can go with RHA2 because it's even softer than RHA3. If a patient comes to me and tells me, I've done so many lip fillers, they're gone within a month. They're gone within 2 months. So then I will go with Juvederm, which is a bit more condensed. And then I'll pick that one because I know that those patients metabolize their filler very, very fast. So then I'll pick something like that. My baseline, my go-to would be RHA3 unless we have that type of concern, specifically for lips. No.
And I feel like too, I don't know if you experienced this as well, but during COVID, when I was in the industry, a lot of our patients that came back with nodules or migration was Juvederm.
Yeah.
So I don't know if there was case studies or if people got the shots or whatever the case might have been regarding that. Juvederm was like the biggest, the brand with the biggest, oh my gosh, I don't know
cases for nodules or...
Yeah, I guess Juvederm was the brand with the biggest cases for nodules after injecting, which, yes, they can happen, but I love how RHA sits in my lips.
Right.
I mean, I've had Restylane, Juvederm, and RHA. With Restylane,
some are more hydrophilic, some are more hydrophobic. Hydrophilic is when the hyaluronic acid pools water and creates inflammation. So sometimes when that pool of water comes, when that inflammation comes, when you have also bruising involved, that can cause nodules.
Yes.
Unfortunately, it can happen with anybody. Some fillers might have higher cases because of the condensity, because of the hydrophility of the filler itself. I've heard about a lot of cases for nodules with Juvederm. Not all the time, but yeah.
Restylane Kiss, like you said, metabolized within a month. I had no filler left from Restylane Kiss, which I loved how Kiss looked because it was a more natural look and approach, because the consistency of the hyaluronic acid is very flexible, so it works really good within your own anatomy of, I guess, the lips or whatever. But I do like RHA because it still feels like you don't have filler in your face, and it's the most natural. And I think clients are most happy with that.
Very happy. They're also happy with the aesthetic look, rather than with just the feel. But you're also very active, so you also metabolize the filler very fast. But that's a good sign for RHA3, because you've done RHA3 and you're very active, and it still sustains and you still have it. So
yeah,
that's why it's our favorite.
You guys did not just see me drink an energy drink. I know they're so bad for you.
Yeah, you need to stop with those.
I've just been on a roll, me and Kayla.
I don't know how you guys do it.
But I do need to stop because I am growing 3 thick chin hairs. And it's from that. So this is my last one.
That will definitely be a reason to stop. Okay, so question for you. So vaginal rejuvenation has been very kind of new to the market. I know there's a lot of questions around it, and we do offer it here. Can you just tell me a little bit more about that?
Yes. So vaginal rejuvenation is a very niche treatment.
Correct.
It's typically in OBGYNs, is where if you do hear about it, that's where you're going to hear about it. But I wanted to bring it into the office to relate to those people and help people with their concerns without being in a doctor office setting and making them feel like something is actually wrong. Yes, and nervous. So our vaginal rejuvenation, we have the Forma V and V-Tone by InMode. So the way Forma V works is it's pretty much a long wand, I guess you would say. And what we do is pretty much lube up the area with ultrasound gel. And what we're doing is targeting the tissue in there and heating it up. So when we're heating up the tissue with the wand, what that's doing is producing more collagen and elasticity. So this is a great treatment for older women as well who have an issue with holding in pee or leakage. If the area is dry, it helps with all of that to help bring it back to life, or bring it back to life, and have a more youthful, intimate area. Then the V-Tone is another machine that we basically insert into the canal. And what this is pretty much Kegels. So we're strengthening the pelvic floor to help tighten the area and just also bring it back to life.
Yeah.
So doing a conjunction of both of those is great. V-Tone you typically do on a weekly basis, and that's about 4 to 6 weeks for a full treatment plan. And then Forma V is normally about once a month. You'll start to see results after 1 to 2 sessions, obviously depending on how severe the case is. You might need more, but I think it's a really great treatment, especially for bringing confidence back to women.
Right.
And knowing that they have this to help them rather than trying to seek help out somewhere else or going the surgical route that can be super scary, and honestly, downtime in that area, I wouldn't want to do.
I think it's great for menopausal women because what happens with menopause is that the cell around the vaginal wall starts atrophying. And when those cells starts to atrophy, this is when the dryness comes, this is when the pain comes, this is when all that discomfort happens.
Yes.
So when you do the laser treatment, you kind of wake up those atrophying cells.
Correct.
So
like, hey, we're back alive.
We're back and functioning. So
and
I think
it's
that's
something
great for
that this is a treatment too in particular. Like, yes, your health always has something to do along it, but you can be the healthiest person and working out all of the time, and there's not really anything that you can do to help this specific concern. And it is uncomfortable, especially with a woman, if you're having linkage or dry and sexual intercourse is like super painful and you don't know why. This is a great treatment to do.
Yeah, and it's very quick and
it's super quick. Yeah, the treatment is about 20 minutes, give or take, and obviously depending on how you upkeep it, maintenance is really only like a year, once a year.
Okay. If you noted, there's actually another form of vaginal rejuvenation, which is not bad. But the other form of vaginal rejuvenation is actually adding
filler.
Right? I'm not
a
big fan of that specifically, but yeah, there's vaginal rejuvenation of just adding filler to the labia majora, which is basically the lips. I don't know if
I would want it bigger.
Some people do. I would not want to. Oh yeah.
Yes.
Thank you.
A girl's gotta eat.
I have to eat.
Yeah. Yeah, I don't know if I would want it bigger.
Yeah, some people do. I don't understand that, and I feel this is a very vascular area. And it's kind of tricky.
I have done Morpheus, so there's also Morpheus V, which is another long handle that you can actually go in Morpheus, which I personally did not bring on because that seems very painful.
Invasive.
But I have done on a few patients the upper area, not necessarily in the actual labia or the lips, but around it. I've used the Morpheus face tip, off label, obviously, very superficial, but that actually has helped tighten the area. And I guess prevent a fupa. Yeah.
I feel like I would trust it more.
And I've seen great results with that, but it really depends on the concerns of the patient and if they want to go through that and if it really bothers them.
Yeah.
What is your favorite treatment that you like to do as an injector that you feel like on any patient can benefit from?
I personally started liking recently the Botox bra lift. Super easy, super quick, and I don't think I've ever had a patient that disliked it. It's not, when I say Botox bra lift, a lot of people think, again, they're gonna look like crazy eyebrows, spooky eyebrow, but that's not the thing. And actually, the patient just left. I did that, and what people don't understand when you do that bra lift, it doesn't really lift up your bra. It opens your eyes. Because what you do is you just inject Botox to the lateral aspect of your eyebrow, and you prevent from the muscle that contracts your eyebrow to work. So you just open it. And it's great even for younger patients. You know, it's not only for droopy eyelid or, you know, droopy eyebrows. It's really just to open your eye and give you a refreshed look. So this is something that I start liking, and I never really have a patient that comes back and say, oh, I don't like what it did to my eye. So I think this is probably one of my recent favorites to do.
I love that.
Yeah.
Also, what are your thoughts on PRP?
PRP is also amazing. PRP, you already know my approach. I'm very conservative. I like the more natural, and PRP is your own plasma. Now, PRP can treat basically everything, right? You can do it with microneedling to improve your skin texture, to improve your skin tone.
It's also great for stretch marks too and scarring.
Yeah, and we just had a patient that had the PRP on her cesarean scar, and her scar is almost gone, completely gone through PRP microneedling that area.
And that's what I love about how the aesthetic industry is kind of transitioning and educating more people on natural treatments. Correct. Because the way our body heals itself is insane, and what we get from our body, it's so crazy how insane those results are to heal anything. Redness, wounds, wrinkles.
Yeah. And you already know I'm a big fan for it for under eye, because
yes,
under eye filler can be great. However, it doesn't always yield a natural result. So if a patient is looking for more natural result, for more refreshment, then I always recommend the PRP under eye.
Yeah, and under eye filler is great for that specific clientele.
Correct. Not everybody is a candidate.
We're back. We had a little intermission. Our day got very busy.
Yes.
So this is like the only 5 minutes we have left to film.
Yeah. Actually, talking about busy, you're a very busy business owner, only at 23 years old. So tell us a little bit about what got you into the business. How are you feeling running a business like this at 23?
I forget that I'm 23 years old. I think that I'm 40 and I like get mad at myself when I haven't accomplished things. But I think opening up Verla with Christy as well is like a full circle moment. And the way I wanted Verla to be to people is not just coming in for treatments or like another med spa. I wanted it to be about the community and involved and engaged, and make them feel like they have a place that they feel safe at and secure, and they can trust us with anything when it comes to aesthetics or anti-aging. And also the way that we implement functional wellness I think is a huge thing for patients, because 90% of the things that are happening on the outside, or why they look dull or a little bit older than they want to, is because of internal things that aren't being fixed. So I think adding that was definitely something that I wanted to do to be different than other med spas and authentic. Definitely stressful, but in a good way. I like being busy and constantly changing things and making people feel good, and also educating patients in the right way with the best services we have. But yeah, this is just the beginning.
Yeah, and you have a long road ahead, and
I do.
Bright future.
And if it wasn't for you guys, we wouldn't be here where we are. So down here in Miami, there's obviously a lot of BBLs.
Oh, yeah.
And yes, you can build a butt in the gym, but a lot of people also, especially older clientele, maybe just want a little bit more volume or some of that elasticity being brought back up again. What would you recommend for that? And also, well, actually, okay, disregard that. I know we do liquid BBLs, so tell me a little bit about the process, the rundown, what's involved, how many treatments, how it works.
Okay. So liquid BBL is, as it sounds, it's a liquid BBL, so it's not an invasive procedure. We don't go in, we don't extract fat from your body and then implement it somewhere else. Liquid BBL is really an injectable in a form of either Radius or Sculptra, which are biostimulators. And we use multiple syringes. It's not like a facial filler. It's not like a facial Sculptra or Radius. We use a lot more. We use a higher volume. Now, it also depends on what the patient will want or what they expect to get. If a patient
plumping the booty up.
Yeah, it's all really to plump it up. Some patients don't want more subtle. Some patients just want to fill those little hip dips that sometimes happen with working out, or even in general, people just born with that. So it really depends what the patient's looking to achieve. So they're looking to achieve a more, natural effect, just to give it a little plump. We'll use a lower amount of syringes. If they're looking to get like a nice little plump, more closer to an actual BBL, we'll use more.
And I actually did Radius on my hip dips. I did very minimal, 5 on 5 on each side. And you do notice the difference, but I always tell patients, and you probably as well, it takes time, and 10 syringes seems like so many. When any client or person outside of the aesthetic industry hears 10 syringes, they think overdone lips. I'm gonna
Right.
look fake, plastic. And when it comes to the glute area and the buttocks in particular,
It's a
it's
higher volume
the
area.
very like it was so minimal.
Mm-hmm.
We notice it because the hip dip area, when they're filled, it looks a little bit more nicer and rounder. But 10 syringes really isn't a lot.
It's not much. It's not much at all. And it's also, you have to think about it. The buttocks is not our face. Our face is our features are very small in comparison to that area. It's a very large volume area. So in comparison to that, you also have to think of adding a lot more than you would
Correct.
to the face. So it's you can't really compare it. Um,
And
not
because it's biostimulators, it's going in conjunction with your own collagen
your own
bands,
collagen,
right?
it also stimulate your own collagen. So it actually increase with time. I feel like sometimes I say to patients, you can wait a month, you can wait 2 months, and you actually see the final results because it will build over time. You will see some effect, you will see some volume right after, immediately after, but you'll see more as the time goes by because it does
Yes.
stimulate your own collagen to build up upon those areas.
And at first, you're definitely swollen, so you're going to look a little bit bigger. But
Yeah,
I think differentiating from Sculptra and Radius, I think Radius you see a little bit more
more
instant
volume. Yeah,
effect. And Sculptra does take that time. Like you're
that time.
swollen, but then it goes down
Yeah,
and then it gradually builds
yeah.
up.
So again, it really depends. If it's a more natural, you can always do Sculptra. If someone wants to actually see the results right away, then I would recommend Radius. And
And how many sessions?
um between 1 to 2, sometimes more. It really
Mm-hmm.
depends. There's not. I wouldn't limit it to just 1 or 2 necessarily, though, because sometimes you can do more. Sometimes people
Yeah.
want to do small increments at a time. So if you say you do 5 syringes per side per session, you can do 2 or 3.
Mm-hmm.
If you do immediately 10 and 10, maybe then I'll tell you, okay, let's wait it out a little bit more. If you want to do maybe like six
And
months,
how
a year later.
often do they come in for those sessions? Let's say if they started off 5 and 5, like I feel like the typical protocol is about 10 syringes of
Yeah, so
treatment.
if you do 5 and 5, which is the minimal, yeah. If you do 5 and 5, you can do it probably every 6 months. But it's also not as invasive and as scary as it seems. We use
Yeah, I
cannula.
just had a few bruises from where you're going in and inserting the cannula
Right,
on like the outer glute area,
right.
but I was pretty much healed 7 days
Yeah,
post,
yeah,
maybe 10 days at the most.
yeah. It's very minimal bruising, and the healing is actually very fast.
Yeah. You
Um,
just are definitely sore. It feels like Charlie horses in your glute area for about 72 hours. So I didn't work out during that time because I
yeah,
just wanted to like let it sit and massage it out is a huge thing
yeah. There's
too.
the 5-5-5 rule.
Yes.
So massage it 5 times a day, 5 minutes for 5 days
Yep.
after you're done with that.
Interesting.
Yeah. The procedure should take around probably 40 minutes. So it's not that complex. It's actually very straightforward and not that scary. But yeah, that's more or less what it is.
So if you guys want some nice peaches, come see Maya.
Oh yeah.
I love
Okay.
these balls. I just want to
I
like
know. Hug it.
hug it.
Um, okay. Are there any new products in the aesthetic world or anything that you kind of excited to bring? Anything new that you can tell us about?
Yes. Well, I'm going to tell you the technology behind a product. There are, I mean, I am a die-hard fan of Skin Better and will forever be because of their technology. No one else does it like them. But there are a few other brands that were originally out of the medical field for exosome derivative
Mm-hmm.
products. And this one company in particular, Plated, I am super excited to bring on because they have a intense serum
Yeah.
that is human derived exosomes. It's definitely a lot more than just like your normal exosomes or plant derivative exosomes. The results are incredible. You can use them post treatment. They also have a hair serum for maybe alopecia clients or people who are just losing hair. That's great. So I'm excited for that world. And
So that brand actually was founded by
Mayo
physicians
Clinic,
in the Mayo
yeah.
Clinic. So they were working. They're working actually on medical solutions for stem cells. They're working on stem cells for all kinds of medical treatments. And
one of their wives,
one of the wives
would this
actually
do good in the aesthetic industry?
She's very smart. I feel
it's so smart. Yes.
Yeah, and this is how they came up with this brand, and they have very limited products, right? Because they're very focused on each product to develop it. So
correct.
I'm actually very excited for them.
I'm excited too. And I've definitely worked obviously with exosomes before, and mainly plant derivative. And yes, you do see a difference, but I think with the plant derivative, our cells don't really know how to comprehend with those. So when you have human derived exosomes, our body already knows how to accelerate that process because it's not a foreign substance or a foreign thing that's happening. It's like, hey, these are already in our body, or they were at a young age. They're healthy platents where that's where the exosomes are getting derived from. So I think the results just make it 100 times better.
Yeah. And I think it's also medically researched and all of that, which puts me at ease when I'm putting something like that on my face and paying that amount of money.
Well, and when you think about it too, it's amazing how they can create that into a serum that it was originally proven or used in like open heart surgeries or like reconstruction or things like that. So you know that it works.
Yeah.
And you know the source that it's coming from is incredible, because that's another thing with, yes, you can have exosomes anywhere, but if it's not coming from a good source, it's not worth it. It's just expensive for no reason.
Correct. Yeah.
That's pretty much it. And we will be back next week.
Yay. Bye.